Today, we're diving into something truly incredible, something most of us almost never think about, the absolute miracle of human movement. I mean, really think about it. You walk across a room, you pick up a cup of coffee, you get out of bed. These things feel so simple, right? But behind the scenes, it's this mind-bogglingly complex symphony of bones, muscles, cartilage, and electrical signals all working in perfect harmony. It's an orchestra we conduct without even a second thought. So, what happens when a musician in that orchestra just misses a cue? Or what if the instruments themselves start to break down? We're going to explore what happens when our body's amazing ability to move comes under attack, sometimes from the inside out. First up, let's talk about what is basically a mechanical failure. I want you to imagine the smooth, protective cushions inside your joints, and just picture them slowly fraying away over time. Welcome to the world of osteoarthritis. At its core, osteoarthritis, or OA, is a wear and tear problem. You've got this slick, smooth cartilage that acts like a perfect shock absorber between your bones. But with OA, that cushion gets worn down, and without it, you get this painful, damaging bone-on-bone grinding. And this, right here, illustrates the difference perfectly. So over on the left, you see a healthy joint, lots of smooth cartilage, plenty of open space. But on the right, that's the reality of OA. You can see how the cartilage is just gone, the space between the bones has narrowed, and the body has actually tried to compensate by growing these little spiky things called bone spurs. You know, this slide really captures a description I've heard from patients that's so vivid. They talk about a symptom called crepitus, and they describe it as a Rice Krispie feeling. It's literally that popping, crackling sensation you can feel under the skin when rough bone is grinding on rough bone. It's a sound you can feel. So how do we deal with it? Well, diagnosis usually starts with imaging, like x-rays. For a really close look, doctors might use something called arthroscopy, where a tiny camera goes right inside the joint. As for treatment, it can range from managing pain with common anti-inflammatory drugs to physical therapy to keep the joint moving as much as possible, and, of course, in really severe cases, surgery to repair or even replace the joint might be the best way to go. Okay, so if osteoarthritis is a mechanical problem, our next condition is all about a communication breakdown. We're moving from those fraying cushions to completely scrambled signals. This is multiple sclerosis, an attack on the body's own internal wiring. With MS, the body's own immune system kind of gets its signals crossed and starts attacking itself. And what it attacks is the myelin sheath, this protective fatty coating that insulates all our nerve fibers. When that insulation gets damaged, it just wreaks havoc on the critical signals trying to travel between the brain and the rest of the body. The best way to think about it is like your nerves are insulated electrical wires. In a healthy nerve, the signal just zips right along, super clear and fast. But in MS, that insulation, the myelin, gets destroyed. And this causes the signal to slow way down, get distorted, or sometimes stop completely. It's literally like a short circuit in your body's electrical grid. And because this short-circuiting can happen to any nerve in your brain or spinal cord, the symptoms are incredibly varied. It all just depends on where the damage is happening. It could cause crushing fatigue, tingling in your hands and feet, problems with your vision, or that muscle stiffness we call spasticity. The location of the nerve damage completely dictates the symptom. You know, another thing is that MS progresses differently for everybody. Some people might have a stable form of the disease with no new activity for years. The most common type is called relapsing remitting, which involves these periods of flare-ups or relapses, followed by periods of recovery or remissions. But others might experience a more progressive course, where symptoms just steadily get worse over time. It's a really unpredictable disease. All right, we've gone from fraying cushions to scrambled signals. Now let's turn to the very framework of our bodies, the bones. What happens when they're pushed past their breaking point? And maybe more importantly, how do they stage their incredible comeback? So not all breaks are created equal. A closed or simple fracture is when the bone breaks, but your skin stays intact. But an open or compound fracture, well, that is much more serious. This is when the broken bone actually punches right through the skin, and that creates an open wound, exposing the bone and everything else to bacteria, which creates a huge risk of infection. So how do doctors fix it? The process is called reduction, which is really just a fancy way of saying they realign the bone. A closed reduction is non-surgical. A doctor will physically manipulate the bone back into place. But for more complicated breaks, an open reduction is what's needed. This is surgery, where a surgeon goes in, directly realigns the bone, and often secures it with hardware, like plates and screws and rods. And this is where the real magic happens. The body's healing process is just phenomenal. First, a blood clot, called a hematoma, forms at the break site. Then, the body builds the soft bridge of tissue across the gap. Over the next few weeks, that bridge hardens into something called a callus. It's like a natural splint. Next, a process called ossification starts, knitting the bone ends together for good. And finally, over months, sometimes even years, the body remodels that bone, chiseling away all the excess material until it's almost as good as new. It's incredible. But as amazing as that whole process is, it's not foolproof. Sometimes things can go seriously wrong, and that can lead to some really dangerous complications. Okay, one of the most critical complications is called compartment syndrome. I want you to think of your arm or your leg as this tightly packed compartment of muscle and tissue. After a bad injury, swelling can build up inside that compartment. If the pressure gets too high, it can literally squeeze the blood vessels shut. This chokes off blood flow, starting the muscles and nerves of oxygen. It is a true medical emergency where every single minute counts. And here it is. This is the key warning sign, the massive red flag for doctors. The main symptom is severe, intense pain that does not get better, even with powerful painkillers. And the reason for that is simple and honestly terrifying. The medication travels through your bloodstream. If the blood flow is cut off, the pain meds literally can't get to the injured area to do their job. Now, beyond that emergency, healing can go wrong in a few other ways. You can have a malunion, which is where the bone heals, but it's crooked or in the wrong position. Then there's a delayed union, which means healing just takes way, way longer than it's supposed to. And probably the worst case scenario is a non-union. That's when the bone just gives up and fails to knit back together at all. So what happens when healing fails or the damage is just too severe? Well, that's when we turn to some pretty major interventions. For a joint that's been destroyed by arthritis or a really bad fracture, a total joint replacement can be a life changer. For a bone that just refuses to heal, surgeons can use things like electrical stimulation or even bone grafts to try and encourage new growth. And in the most severe cases, amputation, followed by a modern prosthetic, can actually be the best path back to mobility. And that really brings us to our final thought here. From the microscopic signals zipping through our nerves to the incredible strength of our bones, our bodies are just so resilient, so adaptive. They're built to heal. This whole journey through how they break down really shows just how much we rely on them every single day. So the question to leave you with is this. Knowing all of this, how can we better support this incredible machine for a full lifetime of movement?